Every year in Malaysia, hundreds of people undergo organ transplants that can save lives, and hundreds more undergo tissue transplants that change their lives. There are two types of organ donation that can be performed: living donation or donation after death. Living organ donation involves donating one kidney or a portion of the liver, while deceased donation in Malaysia involves the heart, lungs, liver, kidneys, corneas, heart valves, bones, and skin. Did you know that deceased organ donation can save up to 8 lives? Organ donation is an extremely important program in our country's healthcare system. How does this process occur? Numerous conditions and illnesses can lead to organ failure. If you experience such a situation, you might require an organ transplant. Patients will be assessed to determine if organ transplantation is the best treatment for them. If you meet the criteria, you'll be placed on the transplant waiting list in Malaysia. This list includes details of patients who have been evaluated and meet the transplantation criteria. However, the waiting list can be long, and suitable organs might take time to become available. The condition of patients may become more critical, and some may lose their lives before organ transplantation is carried out. At present, nearly 9,941 patients are awaiting life-saving organ transplants, and many pass away before getting the chance due to organ unavailability. Most donated organs come from deceased donors. The decision to donate organs is only made after the patient's family and doctors agree that there's no further treatment for a patient declared dead after testing brainstem reflexes. Nursing experts will examine patient data to determine if they are registered organ donors. If yes, they will discuss this matter with the patient's family and seek permission, even if the patient hasn't expressed their wishes. Family members will be asked to decide on behalf of the patient. But did you know that there are myths and misunderstandings about organ donation that prevent many people from making the decision to become donors? So here are some common myths. Firstly, doctors will not try hard to save your life if you are a donor. However, the hospital staff will not give less treatment to donors than they would to non-donors. A medical team will do their best to save your life. Secondly, your religion does not allow organ donation. That's a myth. Most religions allow organ donation. Lastly, you cannot donate if you are under 18. That is also a myth, as you don't need to be 18 years old or older to become an organ donor. Kids younger than 18 can donate their organs too, but they need their parents' consent to be able to donate their organs after death. A tragedy and loss for one family can become hope for another family. When a patient's family agrees to donate organs, tests and personal information will be collected to ensure safety during the organ transplant process. All relevant information will be provided to the surgical team, such as suitable organs, based on factors like urgency and clinical reasons. This is to ensure that the donated organ is suitable for the recipient. Patients who receive organ transplants are given a chance at life that wouldn't have been possible without the contribution of organs from donors and the support of their families. Organ transplant surgery needs to be performed as soon as possible after the patient's death to increase the success of the transplant. However, the process of matching organs with suitable recipients might take a long time. The surgery will be carried out in the operating theater with the same respect and meticulousness as surgeries performed on living individuals. Donated organs will be transported to hospitals across Malaysia and prepared for transfer to selected recipients. These patients are given another chance at life that they wouldn't have had without the kindness of organ donors and their families. In Malaysia, approximately 3,000 transplant surgeries have taken place since 1975. Thanks to deceased organ donors, many organ recipients can continue lives that were previously impossible without transplantation. This not only affects the recipients directly, but also ensures a better quality of life for their families. You can also provide hope to patients and their families by registering as an organ donor through Missigitera. Let's register and update ourselves as organ donor pledgers. One pledge and million hopes. For further information, visit www.dermorgangov.my. Thank you for your time. Let's build a better world, and remember, change begins with you.